Hello everyone, hope you're doing well. Migraine headaches are one of the most common primary headaches and really debilitating, and the treatment has been traditionally difficult, and people usually do not know what to do when a patient with migraine comes up. Well, there's an acute treatment and you must start it as soon as the diagnosed migraine headache starts. Do not wait. The more you wait, the less effective it could be. So right at the start, the evidence suggests that you use NSAIDs plus triptans. The best effective treatment should be started right in the start. Now, which NSAID is the best? Well, there has been some debate, but all the studies have suggested that naproxen is perhaps the best NSAID to control migraines. Now, the best triptan, this is an even bigger debate. Not all triptans are effective on all patients, and if a triptan is not effective on one or one triptan is not effective on a patient, does not mean another triptan will not be. So it depends on the patient response and the availability of triptan in your region. Like in Pakistan, we do not have many, so we use sumatriptan or zolmitriptan, but I told you how it works. Now, that is the headache you've gotten over with in the acute treatment. Who needs a prophylactic treatment of migraine? Well, most colleges' consensus is people who have more than 3 migraines per month. So 3 or more headaches per month, or if the headaches do not go away with acute treatment. So when you get migraines, when you use the triptans and NSAIDs, difficult to treat and very debilitating, then you should use prophylactic treatment. And prophylactic treatment continues for a long time. Which are some of the prophylactic treatments which you can use? Well, if you check the internet and search on Google, you will see class 1, class 2, class 3 drugs, and they include a lot of drugs which are not migraine specific. They've been used for other purposes, but they have effect in decreasing the number of headaches in migraine as well. More than 50% decrease in headaches would be a success for you. Now you can use topiramate, valproate, propranolol, amitriptyline, SSRIs, and flunarizine, very successful. These are some of the drugs that can be used, but how to choose a drug is also important. Notice that you must know these drugs use and side effect profiles as well, and use them for the benefit of the patient. Other drugs might include cyproheptadine and pizotofen, and even lisinopril. If you will search, antihypertensive medication is good for headache prophylaxis in migraines. So now we are also having erinumab and CGRP antagonists, which are used to decrease the number of headaches, and they are migraine specific drugs. So in some years you will see much more use of those drugs. Now what we recommend is choosing a drug according to patient profile and the effects and side effects of the drug. Where, for example, if you've got an obese or fat patient, you might want to use topiramate. Side effect includes loss of weight and decreased appetite. If you've got a depressed patient, then you might want to use amitriptyline or escitalopram or venlafaxine, SSRI, SNRI. If you've got an epileptic patient and you want to use a prophylactic treatment, maybe you use valproate and topiramate. If you got a slim patient, maybe you like to use appetite stimulants, pizotofen or cyproheptadine. Similar, if a patient's got high blood pressure, lisinopril or propranolol might be a good choice. Now these drugs you continue for a long time. Some colleges say that you continue for 6 months or more, and the goal is decreasing the headaches 50% or more. If you're having 10 headaches, then you decrease them to less than 5 and use abortive treatment to treat the headaches that are left. So thank you so much. I hope it helps. Like and subscribe and share this video so that proper treatment can be given. Thank you.